So let's talk about the evaluation process for adult ADHD. What can someone expect when seeking a diagnosis?
Yeah, so the first thing you're looking for is a specialist. I think just because of our field's history and how we're all catching up, I think it really does take someone who does this and this is what they do to most give you the most accurate diagnosis. So once you find that specialist, the ADHD evaluation process usually takes about 2 to 3 hours. There's usually a couple of different steps. To differentiate it from other conditions, you need to do what they call a multi-data assessment. So one thing you might do is you give rating scales and questionnaires or have someone who knows them well come with them to the evaluation. This is because folks with ADHD tend to underreport symptoms or their traits. So they might not always be 110% aware of some of the things that they do that might be different and might meet criteria for ADHD. The next thing you're going to do is administer rating scales and questionnaires to them. So what those rating scales are measuring are executive functions, and they're normed between the neurotypical population and the ADHD population. So you're trying to see if those scores align repetitively with individuals in the ADHD world to see if those folks struggle with executive functioning stuff more than the neurotypical population. You're then going to do a thorough interview. And so the thing to recognize is that all people at points of their lives might have differences in their executive functioning, and they might have challenges in their terms of their focus. But ADHD has a developmental course. So it's the entire life course is in some way affected and could get different and change, or they could have trouble with focus in different ways based on their circumstances. But it's always something that's been happening, since childhood. And then you also should expect some sort of objective tests. There's lots of different ones you could do.